We're sitting here in these absolutely magnificent grounds of St. John's College, Cambridge University, at the combined meeting of the International Intradiscal Therapy Society and the International Society for Minimally Invasive Spinal Surgery. With me today is Dr. David Casper of Oklahoma City. Dr. Casper is a noted spine surgeon who has presented some excellent work here today. And I wanted to talk with Dr. Casper a bit with a live camera. Dr. Casper, tell me where you see spine surgery going over the horizon over the next 5, 10, 15 years.
Well, I think clearly the focus is going to be on minimally invasive spine surgery in terms of not only accessing the pathology, disc herniations, bony stenosis problems, etc., but in the tools that we have available to use to relieve the problems associated with those entities. Laser procedures, smaller, finer tools, chemicals perhaps, ultimately with stimulation of the cells in the disc and attempts to repair disc material. I think all of those things are not too much in the far distant future.
Do you see anything in terms of questions I'm sure you are asked as much as we about artificial discs or disc substitutes and things like that? Do you see that coming along at any point in the future?
Yes, I think clearly the biologics, the information that we have now will allow some people to be able to go ahead and explore artificial discs. But I think still the goal here would be to repair or fix what we have. Certainly that is not going to be available in all cases.
What would you like to do for the future? Where would you see your particular efforts going in terms of spine surgery for your patients?
Well, I think that the question is relatively broad. I think that I would like to see the biologics have more to do with the ability to repair spinal injuries. I think that fusion techniques will be altered greatly, and I think that the artificial disc is certainly on the horizon.
What about the speculation that surgery will eventually have no place and that we'll be able to do this all chemically with medication? Do you see that any time in the near future?
Well, as a surgeon, I hope that never happens. No, I think there will always be a role for the surgeon. I think anytime you're working in an area that requires knowledge of anatomy and anatomical structures and the potential for injury, that the surgeons are going to be needed. I think our role will be different. I think that we will be challenged to do things with much less invasion of tissues, and I think that's where the surgeons of the future will be.
That's great. David, thank you very much. I very much appreciate you being with us today.
Thank you, Larry.
Thank you.